Welcome. Today we're diving into a rare and complex topic: cardiac sarcoma. While heart disease often brings to mind conditions like coronary artery disease or heart failure, cardiac sarcoma is a malignant tumor arising within the heart itself. Join us as we explore its causes, effects, and the challenges of diagnosis and treatment. The exact causes of cardiac sarcoma remain largely unknown. Unlike some cancers with clear environmental or genetic links, cardiac sarcomas often appear sporadically. Genetic predispositions are suspected but not definitively proven in most cases. Some research suggests a possible association with prior radiation exposure, but more studies are needed to solidify this connection. For now, cardiac sarcoma is generally considered to arise from a combination of factors that are still being investigated. Cardiac sarcoma wreaks havoc by directly infiltrating and disrupting the heart's structure and function. The tumor can grow within the heart chambers, obstructing blood flow and mimicking valve disorders. It can also invade the heart muscle, causing arrhythmias, heart failure, and pericardial effusion, fluid accumulation around the heart. Its location and rapid growth rate are key determinants in the type and severity of the symptoms it presents. Cardiac sarcomas are exceedingly rare. They account for a tiny fraction of all heart tumors, with estimates suggesting less than 0.1% of all primary heart tumors being sarcomas. Due to this rarity, precise epidemiological data is difficult to obtain, and large-scale studies are limited. It's more frequently diagnosed in adults, often between the ages of 30 and 60, but can occur in younger individuals as well. This rarity adds to the diagnostic challenges and underscores the need for increased awareness. The signs and symptoms of cardiac sarcoma are notoriously varied and often mimic more common cardiac conditions. Patients might experience shortness of breath, chest pain, fatigue, and palpitations. Other possible symptoms include swelling in the legs and abdomen, dizziness, and unexplained weight loss. Because these symptoms are nonspecific, cardiac sarcoma can be easily misdiagnosed, leading to delays in appropriate treatment. Diagnosing cardiac sarcoma is a complex process. It often begins with an echocardiogram, which can visualize the tumor mass within the heart. Cardiac MRI provides more detailed images of the tumor's size, location, and involvement of surrounding structures. A CT scan can help assess the extent of the disease and look for metastasis. However, the definitive diagnosis requires a biopsy, removing a tissue sample from the tumor for microscopic examination. This biopsy is crucial for confirming the presence of sarcoma and determining its specific subtype. Several types of cardiac sarcomas exist, with angiosarcoma being the most common. Angiosarcomas originate from the cells lining blood vessels. Other subtypes include undifferentiated pleomorphic sarcoma, leiomyosarcoma, fibrosarcoma, and rhabdomyosarcoma, each with unique microscopic characteristics. The specific subtype influences treatment options and prognosis. Treatment for cardiac sarcoma is challenging and often involves a multidisciplinary approach. Surgical resection or tumor removal is the ideal treatment if possible. However, due to the tumor's location and the extent of its invasion, complete surgical removal is frequently not achievable. Chemotherapy and radiation therapy are often used in conjunction with surgery to shrink the tumor, control its growth, and prevent metastasis. Heart transplantation may be considered in select cases, but the risk of recurrence remains a concern. Palliative care focuses on managing symptoms and improving the patient's quality of life. Given the lack of established risk factors, there are currently no specific preventive measures for cardiac sarcoma. Maintaining a healthy lifestyle, avoiding known carcinogens, and undergoing regular medical checkups are general recommendations for overall health, but they are not specific prevention strategies for this rare disease. The prognosis for cardiac sarcoma is generally poor, largely due to its aggressive nature, late diagnosis, and difficulty in achieving complete surgical removal. Recent research is focused on developing more effective targeted therapies and immunotherapies to improve outcomes. Researchers are also exploring the potential of liquid biopsies to detect early signs of recurrence. Early diagnosis and aggressive treatment are critical to improving the chances of survival and enhancing the quality of life for patients affected by this devastating disease.